Now, you're not supposed to do this, but this how I do it.
Okay.
Now, you also not supposed to do this, but this how I do it. Nobody showed me this, but I'm telling you. Okay, so don't tell nobody. All right. This how I do it.
An inch of 100% lime juice or one whole lime, a whole glass of water, and a bit of sugar for flavor. After drinking this 3 times a day, it was gone.
Did she just describe homemade lemonade, sugar, water, and lime? Hi, my name is Dr. Rich, and I'm passionate about providing every woman with practical knowledge about the world of women's health. Urinary tract infections, or UTIs, are a very common reason for a visit to the doctor's office. They're usually easily treated with an antibiotic, but some patients suffer from recurrent and even severe illness from urinary tract infections. And make sure to stick around to the end to find out my #1 home remedy. So, what is a recurrent urinary tract infection? Well, this is defined as 3 infections in 1 year or 2 infections in 6 months. Urinary tract infections are common in women of all ages. We'll break down the risk factors in different categories. 1, behavioral, 2, urologic-based risk factors, and 3, genetic. So having a new sexual partner within the last year, using a spermicide with or without a diaphragm, your mother having UTIs, or your first UTI occurring before the age of 15 are risk factors for getting them recurrent. So cystocele or bladder prolapse, or your bladder falling down, or a bulge sensation in the vagina, is actually a common risk factor for recurrent urinary tract infections. In fact, as your gynecologist, I'll often get referrals every week from patients that have been hospitalized multiple times a year for years or even decades, and the patient didn't mention that she has the bulge, the family doesn't know, the primary care doctor doesn't know, and it would be a relatively simple fix to correct the prolapse or the bulge and reduce the recurrent infections. So urinary retention can also cause infections. So this is the sensation that you're not emptying your bladder. Now that may be due to a fallen bladder or bladder prolapse. Can also be due to a prior surgery where someone's had a sling, it's too tight and you can't empty your bladder. But these are things that commonly come up with patients who have recurrent infections. So why do urinary tract infections happen in the first place? Well, essentially, there are normal bacteria that live in the colon, such as E. coli. There are normal bacteria that are in the vagina, called lactobacillus. And there's a normal flora for bacteria in the bladder. But what happens is when these get moved around and you get E. coli type bacteria into the bladder, that's when urinary infections occur. So basically, you've got the right bacteria in the wrong place. So the diagnosis comes from doing a urinalysis and a urine culture. Now, this isn't necessary every time you have symptoms, but it's certainly necessary to establish the diagnosis for the 2 infections in 6 months or 3 in a year. Once there's a diagnosis of recurrent infections, then we can kind of treat as needed. So additional workup, including a CAT scan or cystoscopy, those are reserved for refractory cases or cases where we suspect another cause, like an anatomic abnormality or a kidney stone, or urinary retention from some type of surgery. So how do we not get UTIs? Well, liberal use of water, 2 to 3 liters of water a day, can significantly reduce the number of recurrent infections. Changing contraception types, so something that does not contain spermicide. Peeing after sex or postcoital void. So urinating immediately afterwards can also reduce the risk. And as your grandmother told you, wipe from front to back. As simple as that sounds, is a cause of more than 1 UTI. So how about medications for prevention? Well, we do not want to use long-term antibiotics only as a last resort because it builds up bacterial resistance, and eventually there won't be any antibiotics that can treat the infection, and that can lead to kidney infections, sepsis, and in rare cases, it can even be lethal. So one of the simple and best preventative medications is vaginal estrogen, particularly in postmenopausal women. The cream helps to support a normal vaginal flora and normal urine flora and prevent the ascension of bacteria from the colon into the bladder. So there are several medications in clinical human trials that have shown a reduction in the risk of recurrent urinary tract infections. So one of those is cranberry, whether that's in a pill or actually just drinking. That prevents the binding of the bacteria to the wall of the bladder or the urothelium. Number 2, probiotics. So it's important to maintain a normal, healthy vaginal flora with the bacteria that's supposed to be there, lactobacillus, that prevents other bacteria from being able to exist in that area and ascend to the bladder. Number 3 is methanamine, which is not an antibiotic. It acidifies the urine and has general antibiotic properties and prevents infections from taking hold in the bladder. Number 4 is D-mannose, and this is my number 1 recommendation. It's similar to cranberries, prevents the binding of the bacteria to the bladder wall and reduces the risk of infection. The great thing about these 4 treatment options is that none of them promote bacterial resistance. So when is it appropriate to use antibiotics? Well, for patients that get recurrent infections and they have predictable symptoms, in those cases it can be appropriate to give a prescription with multiple refills so they know that they can take the antibiotic when they need to take it. Another appropriate time is what's called postcoital antibiotics. So this is to take an antibiotic right after sex, which is the most common time for bacteria to be able to get into the bladder and cause an infection. So what are the downsides of too much antibiotics? So we talked about bacterial resistance, which can lead to severe infections. Also, there's direct toxicity. Some people are allergic to antibiotics and can have severe reactions. Furthermore, taking antibiotics all the time kills your normal gut flora, the good bacteria that's supposed to be there. And as a result, you can get something called C. diff or Clostridia, which is a severe diarrhea infection that in some cases can't be improved without a fecal transplant. And you don't want that. So citric acid, whether that's lime, lemon, or supplement, actually does reduce the risk of calcium oxalate stones or kidney stones, but not specifically reducing the risk of UTIs unless they are associated with kidney stones. On the other hand, cranberry juice is protective at preventing the risk of recurrent urinary tract infections. There have been studies that have looked at a number of essential oils or essential oil that'll derive products like thyme and lemongrass and tea tree oil and the active ingredients thereof in a lab, in a dish where they've been shown to decrease the growth of bacteria. Now, there are no studies that show that there's any benefit to any of these things in human trials, and so you would maybe consider that after you've tried all of the other treatments that we talked about today. We and your well, thank you for that. Thanks for sticking around to the end. I know that was a lot of information. Please like, share, and subscribe, and then tell all your friends, and then